BioVendor has a long tradition in development of immunoassays as well as antibodies and recombinant proteins. Our ELISA kits for the determination of biomarkers in various clinical fields have gained a good reputation and were frequently referred in top-class scientific journals. Now, I would like to talk about biomarkers of renal disease, and I will tell you which of our immunoassays are really relevant in diagnosis and research of renal disorders. Here is the list of the most important BioVendor kits from this area of investigation. First, I would like to talk about our top molecules in this group, about Cystatin C and Uromodulin. Cystatin C is a small molecule produced at a constant rate by all nucleated body cells. It's freely filtrated in kidneys, and it's negatively correlated with glomerular filtration rate. Due to these properties, Cystatin C ranks among sensitive markers of both acute and chronic kidney injury. As you can see on figure, it faster increases in serum of Acute patients compared to established marker creatinine. So, we can say that Cystatin C is a really superior predictor of kidney disease. Besides kidney injury, Cystatin C is also associated with other disease, such as inflammation in general, cancer, neurodegenerative, and autoimmune diseases. Uromodulin. Uromodulin is most abundant urine protein produced by kidneys. It plays a protective role with respect to renal stone and urinary tract infection. Based on the hypothesis, BioVendor, together with hospital in Prostějov, decided to verify potential of uromodulin in serum of patients with nephropathy. We found that serum uromodulin, not urine, is excellent marker for kidney injury. As you can see in graph, here is minimal concentration overlap between nephropathy patients and negatives. These findings were confirmed also by further studies. So, we can summarize that uromodulin, also known as Tam-Horstfeld protein, is a perfect diagnostic marker of chronic kidney disease. But as you can see in the graph on side, it's also excellent predictive marker of chronic kidney disease progression. It's obvious that with decreased glomerular filtration rate, rapidly decrease uromodulin concentration. Uromodulin plays a role as a predictive marker for cardiovascular events too. Lipocalin 2, well known as NGAL, is markedly elevated in kidneys in some acute kidney states, which leads to sharply increased release of the protein into urine and serum. It follows that NGAL is early diagnostic marker of acute kidney and renal injury. NGAL has also close relation to insulin resistance and diabetes in obese people and correlates with various malignant disorders, as you can see in the scheme. Here is the overview of selected renal disease kits. I would like to mention that we successfully offer, except human, also animal assays, mainly canine Cystatin C ELISA. All the mentioned kits in the table we recommend to divide into sale packages according to their intended use. For renal disease portfolio, it means diagnostic packages for acute kidney injury and chronic kidney disease, and prognostic package for chronic kidney disease represented by uromodulin assay itself. Besides immunoassay, we normally offer also proteins and antibodies. In next 2 slides, you can find selected ones. Here is the list of BioVendor proteins, and here is the list of BioVendor antibodies. I believe you have found something interesting in my presentation, also for your work, but it was just a little testing of a wide offer of BioVendor biomarker immunoassays. Visit us at the BioVendor.com website, where it's very easy to find an ELISA kit, protein, antibody, or microRNA immunoassay meeting your needs. Feel free to contact our product managers and ask for help. Thank you for your attention.